Hello everyone, welcome to NG's Corner for Nurses. Hope all of you are doing well. When we talk about the burn management, the most important part is the fluid replacement therapy. For that, fluid requirement calculation is the primary thing what we have to know. Fluid calculation for burn patient can be done by different formulas like Parkland formula, Brooks formula, Evans formula or Monafo formula. But widely accepted one is the Parkland formula. So today our topic of discussion is Parkland formula. In this video, we will cover the concept, use and calculation of Parkland formula along with examples. Parkland formula was developed in 1968 by Dr. Charles Baxter. So, this formula is also known as Baxter formula. This formula has led to better patient outcome and has become an integral part of burn protocols. The Parkland formula calculates the amount of fluid that should be administered to critically burned patients over the first 24 hours post-injury. And this formula is used for burns that encompasses more than 20% of the total body surface area that are either second degree burn or third degree burns. Next, we are coming to why is the Parkland formula used. The main objective of the Parkland formula is to calculate the ideal amount of fluid which is required to rehydrate and prevent further damage to burn patient. Now the question comes, why this fluid requirement is necessary? To know that, we have to know the pathophysiology behind the burn injury. Whenever a life-threatening burn injury occurs, it may activate an inflammatory response system which can increase the capillary permeability, thereby shifting the fluid dynamics and causing intravascular fluid, plasma proteins and electrolytes to relocate to the interstitial space, that is the area in the tissue surrounding cells. This fluid shifts leads to insufficient intravascular fluid causing hypoperfusion, decreased cardiac output and consequently cardiogenic shock and tissue damage. If this condition left untreated, hypoperfusion can lead to end organ ischemia. This process begins immediately after a burn and peaks 8 to 12 hours later. Therefore, the first 24 hours after a burn injury are critical for fluid resuscitation. That's why we are doing this fluid replacement by using Parkland formula to know what is the exact amount of fluid which we have to infuse. Next, coming to the Parkland formula for adults. For children, there are different formula. The formula is 4 ml into body weight in kg into total body surface area percentage equals to total crystalloid fluid over the first 24 hours. In this formula, 4 ml is constant. Next, the patient's body weight in kg and the total body surface area percentage. There are various formulas for calculating total body surface area that we have already discussed in our last video. If you want to review it, then please go through that video. Link is given in the description box. And the most common formula we are using for total body surface area calculation, that is the rule of 9, equals to the total crystalloid fluid. Why the crystalloid fluid? Crystalloid fluid is a solution with small molecules that can move into cells. And why we are using it? To expand the intravascular volume, without disturbing the ion concentration or causing significant fluid shifts between intracellular, intravascular and interstitial spaces. Over the first 24 hours, we are administering this total amount of crystalloid fluid. In this case, we are using Ringer's lactate because Ringer's lactate solution is the preferred first line fluid recommended by the British Burn Association. Its composition and osmolarity closely resembles normal bodily physiological fluids, and it also contains lactate which may buffer metabolic acidosis in the early post-burn stage. Now, by this calculation, we are getting the total crystalloid fluid which we have to administer in first 24 hours of burn injury. The half of this total amount should be given in first 8 hours and the next half should be given in next 16 hours. Now, we have to remember this. The first 8 hours is from the time of burn injury. Time from the burn injury, not from the time of hospitalization or the time of assessment or calculation. Okay, suppose if the patient comes in the hospital 1 hour after the burn injury, so immediately when we are administering the first half of the fluid, we have to give it within 7 hours, increasing the fluid rate to maintain the first 8 hours protocol of Parkland formula. So it is very important to maintain the amount of fluid as well as the time of infusion and also the information about the time of injury. Let's see an example. Young male weighing 70 kg has second degree burns in both entire lower legs. Calculate the total amount of fluid replacement in first 24 hours by using Parkland formula. So the formula is total fluid equals to 4 ml into body weight in kg into total body surface area percentage. So 4 into body weight is 70 kg into the total body surface area. Here the both entire lower legs are injured. According to rule of 9, each leg is 18%. So here the total body surface area percentage should be 36%. That is 18% plus 18% equals to 36%. So 4 into 70 into 36 equals to 10,080 ml. That is the total amount of crystalloid fluid that should be administered in first 24 hours. Half of this 10,080 ml, that is 5,040 ml Ringer's lactate should be administered in first 8 hours and the rest 5,040 ml Ringer's lactate should be administered in next 16 hours. Next example, a male patient with 65 kg comes with full thickness burn injury in entire right arm and anterior trunk. Calculate the total amount of fluid replacement in first 24 hours by using Parkland formula. So here the body weight of the patient is 65 kg and the total body surface area percentage, that is right arm plus anterior trunk. So according to rule of 9, right arm equals to 9% and anterior trunk equals to 18%. That is total is 27%. So 4 into 65 into 27 equals to 7,020 ml. That is the total fluid requirement in first 24 hours. The first half of the total fluid, that is 3,510 ml Ringer's lactate should be administered in first 8 hours and the rest part, that is the second half of the total fluid, that is rest 3,510 ml Ringer's lactate should be administered in next 16 hours. If this video is useful for you, then it is requested to put a like and share it with others. And for getting more videos like this, you can subscribe my YouTube channel or follow my Facebook page NG's Corner for Nurses. And for any queries or suggestions, you are most welcome to comment. Thank you for listening.